Welcome to Defense Art TV. I'm your host, Sifu Robert Brown. Today's show is about body targets and what happens when we strike them. It features Dr. Mike Savona, Hawaii's Doctor of the Year for 2003. So stay tuned for the effects of striking vital zones on Defense Art TV.
Aloha, my name is Sifu Douglas McLeod. We have our special guest, Dr. Savona. Thank you for coming.
You're very welcome, Doug. Now, the so-called floating ribs, the last two ribs usually do not meet into this arch here, and for reasons that defy explanation have been called floating ribs. They don't float at all, they just are there. And yeah.
Where's the extra one that woman has?
The floating ribs.
Well, from the back is where you'd have to hit them. They're not accessible from the front. Yeah.
Where's the extra rib that a woman has?
Yeah.
Well, that's myth too. Yeah, that's myth too. Alrighty, so here we go. Up higher up here, there are the clavicles here are areas that are also attack areas, and the clavicle itself is a fairly thick bone, but it's susceptible to break with trauma. You know, it's not hard to do that. And what happens with that, you know, the purpose of the clavicle is to keep our shoulder out here. Without the clavicle, every time you picked up something to move it, you'd hit yourself in the face with your shoulder. So the clavicle serves to keep that out. If you can effect a break there, which isn't hard, but you know, again, it's a tough bone, but with a downward blow, you could certainly crack it. And if that happens, this arm pretty much becomes useless from the shoulder area down. And so you have somebody who's restricted just to using, yeah, these are the collarbones right here. Okay, looking at the shoulder, I wanted to look or show you a little bit about the anatomy that's in the that wonderful area we call the armpit. Okay, this is an area where, for most people, as you know, they're very ticklish. And why are they ticklish? If you look, I'm sorry.
A lot of nerves.
Absolutely. If you look at this, look at all the nerves that cross through that area. So there's a lot of nerve tissue there.
Is that indicated in yellow?
Yes, it's indicated in yellow. Where these nerves are coming from, this is just to orient you folks. This is the shoulder. This here would be the deltoid muscle. They've peeled away some of the portions of the deltoid that extend into the chest. And then we have a couple of vessels here, an artery and a vein. These are actually the brachial artery and the brachial vein. And then behind them here is a thick nerve bundle. It's about as thick as your index finger, that we call the brachial plexus. And where that lies is at if you look at your armpit and you think of it as a pyramid, you know, a three-dimensional triangle, I guess, is right at the apex of it is where that is. So, and it's very, very sensitive. So a blow to that area, you know, be that by bee sting or be that by, you know, one of the things we've been working on with the wrist grab break, where you come down with an elbow poke into that area, very, very uncomfortable. Very, very, and you know, most people, of course, are real uncomfortable if you just even try to tickle them there. They don't want to, you know, they come right down like that and all. Now, again, it's a place that's not hard to defend, though, because you know all your muscles will allow you to pull it down, and it's a matter of speed and timing to get at it. But there's lots and lots of structures there that are susceptible to damage and to, and of course, this causes a lot of intense pain. And the brachial plexus, or a lot of these nerves as they come out, these nerve bundles that come out here, will cause a lot of dysfunction to the arm. Now, most people have had the occasion where they have hit their funny bone. Okay, well, what's the funny bone? There is no funny bone.
Damn funny about it.
Yeah, what this has to deal with is that by your elbow here, in the upper part of the arm, these nerves, which we call the bundle of which we call the brachial nerves, divide up into three branches. One we call the ulnar nerve, one we call the median nerve, and the other we call the radial nerve. But the ulnar nerve is the one that hooks around the bottom of the humerus here, just above the elbow, and is susceptible to trauma. We've all had the occasion of bumping it, and what happens? You lose strength in your hand, and it's numb. It's like you've slept on it for 10 hours, and it can take a long time for that to come back. So these are areas that, again, pressure on them could create a real problem for somebody. So you can lose the power and strength.
Why,
Is this the nerve cluster that makes an armbar effective?
Yes.
We're
absolutely.
activating where those three nerves come together.
That's
Is that
right.
what we're
Right up in
activating?
here. That's exactly right.
Okay. So what Sifu Mike likes to call the Golgi cluster
That's right.
is where those three nerves are coming together.
That's right.
You activate those nerves, it shuts. What exactly is that doing physiologically? Is that shutting down the nerve impulses to the arm?
It's very painful, as you know, if they've ever put an arm bar on you. You want to go with it. This is not something you want to resist, and that's your body's basic instinct telling you you have to. You can't let this be there.
Uh-huh.
It's painful, but also you've got no strength in your arm when that happens.
So it shuts down the nerve impulses.
It sure does, and your hand is limp.
Okay.
And you would have to be, in my mind, incredibly disciplined to have somebody doing that to you and think of, I can do this to them. Because when that happens, that's like somebody grabbing your testicles. The thing you want to do is get away from that. Yeah, you're not going to be thinking, well, what did they say the technique against this?
To my knowledge, we have.
Please don't GI.
That's right. So I mean, that's exactly what it is. A lot of pain, but mostly your arm is like goes dead. You just can't use it. You cannot resist that. And in fact, you don't want to, because you're trying to work against it creates more pressure here, and that's why people who get this, have these locks, these joint locks, like Sifu Mike was showing, move with them. You don't see many people, trying to do something. I mean, you go with it because you don't have a choice.
He's done that lock set on me a number of times.
It's hard. It's really hard.
I've never once resisted it yet.
When you hit underneath here, right here, why does a person have a tough time breathing?
Oh, because what happens with that, Sifu Tony, is when you hit somebody in that area, what you create is you create a pain syndrome that tightens all those muscles up. Okay? When you tighten those muscles up, you do not use them effectively to breathe. When we breathe, let me just go back and I'll show you on the thoracic cage, if I can bear with me for a minute here. When we breathe, if you visualize it, you can see a little bit in the background, in the back here, but not in the front. Between the ribs, there are three sets of muscles. We call them the intercostal muscles. And what they are is there's a group of fibers that are straight up and down, and then there's obliques in both directions. We have external oblique, internal oblique, and the intercostal muscles. These are what keep the ribs in their proper position so that the rest of the muscles of the chest wall, particularly muscles like the serratus anterior and the pectoralis muscles, can help us to breathe by doing that swinging of the handle of the bucket out. And then, of course, we have our diaphragm at the bottom that pulls down to fill the lungs with air. When you hit somebody there, when you hit them over here, and of course, this is where the ribs turn around here. So it's a susceptible area for a blow to cause a lot of pain. These muscles, your tendency is to tighten up all the muscles on that side. It is painful to take a deep breath.